Can I ask you something a little personal? Have you been treating high blood pressure, but still feel dizzy, tired, or not quite yourself? You take your pills. You follow your doctor's instructions. You're doing everything right. But somehow your brain feels slower. Your balance isn't what it used to be. And you wonder, is this just getting older or something else? You're not imagining it. The truth is, high blood pressure treatment in older adults is very different from how it's managed in younger people. Your body changes. Your brain becomes more sensitive. And medications that help your heart can quietly hurt your clarity. Studies from Harvard Health, Mayo Clinic, and the National Institute on Aging have shown that overly aggressive blood pressure control in seniors can lead to side effects like fatigue, falls, and even memory issues, especially when doctors aim for younger person goals in older bodies. But here's the good news. There's a better way. In today's video, I'll walk you through 6 smart, simple steps to treat high blood pressure after 60 without losing your balance, your memory, or your peace of mind. If you've ever felt more foggy or tired after starting blood pressure meds, type yes in the comments. If not, type no. Either way, you're not alone. At Dr. Brain, we believe your heart and brain should be treated as one. Let's begin. The silent burden. Why treating high blood pressure in older adults is different. High blood pressure is called the silent killer. But for older adults, the treatment can become a silent burden too. Most people assume that blood pressure should be kept under control at all costs, that the lower, the better. But that rule doesn't always apply after 60. Here's why. As we age, our bodies and especially our brains change. The blood vessels become stiffer. The nervous system reacts more slowly. And the brain becomes more sensitive to drops in blood flow. What does that mean? It means that lowering blood pressure too aggressively can cause more harm than good. You might feel lightheaded when standing. Your balance might weaken. You may have trouble concentrating or feel mentally foggy. According to the National Institute on Aging, older adults whose blood pressure falls too low are at increased risk of falls, dizziness, fatigue, confusion, and even small strokes that go unnoticed. The American Geriatric Society recommends a more cautious approach. Start low, go slow, and always evaluate the whole person, not just the number on the screen. Unfortunately, many seniors are still being treated as if they were 35 years old. Doctors may aim for numbers like 120 over 80 without realizing that for an 80-year-old, that could mean not enough blood is reaching the brain. Have you ever felt dizzy, tired, or foggy after starting or increasing blood pressure medication? Type yes if you have, or not sure if you're still figuring it out. The key takeaway: your brain and heart are connected. When one is treated without considering the other, it can lead to silent damage. That's why this video isn't just about numbers. It's about bringing back the big picture so you and your doctor can make safer decisions together. Let's take our first step in that direction now. Step 1. Confirm the diagnosis correctly. Before any treatment begins, we must ask the most important question. Is the diagnosis even accurate? High blood pressure or hypertension is often treated aggressively in older adults. But sometimes the problem isn't high blood pressure itself. It's how and when it was measured. Here's what many people don't know. Blood pressure can vary dramatically depending on the time of day, your posture, your breathing, and even your stress level at the moment. A single high reading in the clinic, especially if you're anxious or rushed, doesn't automatically mean you have chronic hypertension. In fact, according to the National Institute on Aging, a condition known as white coat hypertension can lead to false diagnosis and unnecessary medication, particularly in older adults. This happens when blood pressure rises only in medical settings but remains normal at home. So, what's the right approach? It starts with proper technique and repeated measurements. Sit quietly for at least 5 minutes before measuring. Support your back and feet. Rest your arm at heart level. Avoid caffeine, smoking, or exercise 30 minutes prior. Take multiple readings over several days, including at home. Only then can we get a true picture. And that picture matters because misdiagnosing high blood pressure can lead to overtreatment, which increases the risk of dizziness, falls, and cognitive issues. Have you ever had your blood pressure taken without rest or while feeling anxious? Type yes in the comments if you have, or no if your doctor always takes time to check it properly. Accurate diagnosis is not a formality. It's the foundation of everything that comes after. At Dr. Brain, we always say, don't rush the numbers, your brain deserves better math. Let's move on to step 2. Step 2, start with lifestyle. First, if appropriate, when we hear the words high blood pressure, many people think of medication right away. But for many older adults, the first and sometimes most powerful step doesn't come from a pill, it comes from lifestyle. According to the National Institute on Aging, changes in diet, physical activity, sleep, and stress levels can significantly reduce blood pressure, sometimes by as much as 10 to 20 millimeters of mercury, without medication. And for the aging brain, that matters because lifestyle changes not only help the heart, they also support memory, reduce inflammation, and improve overall clarity. Here's what that might include. Diet following a heart-healthy eating pattern, such as the DASH diet, which is rich in fruits, vegetables, whole grains, low-fat dairy, and low in salt and saturated fat. Movement, light to moderate activity, such as walking 20 to 30 minutes a day, or gentle stretching helps regulate blood pressure and circulation. Hydration and sodium. Balance. Drink enough water and reduce processed foods high in sodium, which can raise blood pressure even when you feel fine. Sleep and rest. Getting 7 to 8 hours of quality sleep per night helps stabilize blood pressure. Mood and brain function. Stress management. Simple breathing exercises, quiet time, prayer, or mindfulness can help reduce surges in blood pressure related to chronic worry. These are not extreme changes. They're gentle, gradual, and deeply restorative. And here's the good news. Even small steps matter. You don't need to become a new person overnight. You just need to support your body in the right direction. Have you ever tried adjusting your lifestyle to improve your blood pressure before starting meds? Type yes if you've done it, or no if you're just learning this today. At Dr. Brain, we believe what you eat, how you move, and how you rest can be medicine without a prescription. Let's move to step 3. Step 3. If medication is needed, go low and slow. Sometimes lifestyle changes aren't enough, and when that happens, medication becomes necessary. But here's the truth. Many older adults are never told. The way we prescribe blood pressure medications to seniors should be different. Not because you're weak, not because your body is failing, but because your brain and circulatory system have changed with time. After age 60, the brain becomes more sensitive to drops in blood pressure. If medication lowers it too quickly or too far, the brain may receive less blood, leading to dizziness, falls, fatigue, or mental fog. That's why the American Geriatric Society recommends this approach: start low, go slow. Instead of rushing to hit a textbook number like 120/80, the goal should be to stabilize you, not shock your system. This means starting with a low dose, monitoring side effects carefully, increasing only if necessary and gradually, watching for signs of overtreatment, not just undertreatment. According to Harvard Health, older adults often respond strongly even to small doses, so more medication isn't always better. And remember, numbers are helpful, but you are not a number. What matters is how you feel your balance, alertness, and energy. Have you ever felt worse after starting or increasing a blood pressure medication? If yes, type yes in the comments. If not, write no either way. Your experience matters. So, if you're starting a new prescription, ask your doctor, can we start with the lowest possible dose? How will we know if it's working or doing too much? What should I watch for at home? Because good blood pressure control should protect your brain, not compromise it. At Dr. Brain, we believe the smartest dose is the one that keeps you steady. Let's move on to step 4. Step 4. Monitor for overtreatment. Treating high blood pressure is important, but treating it too much can quietly cause harm. This is something we don't talk about enough. Most people, and even some doctors, focus so much on getting the numbers down that they forget to ask, is this too low for this person's age and brain? In older adults, blood pressure that is too low can reduce the amount of blood reaching the brain. Over time, this may cause dizziness, daytime fatigue, feeling foggy or confused, increased risk of falling, tiny silent strokes that go unnoticed, but affect memory. This is what doctors call overtreatment, when medications work too well and cause side effects from lowering blood pressure below what the brain needs. According to the American Geriatric Society, blood pressure readings below 120/70 in older adults can be dangerous if they come with symptoms. So, how can you tell if you're being overtreated? Watch for systolic pressure top number under 120 mmHg, unusual tiredness or drowsiness, feeling faint when standing up, difficulty concentrating, new confusion or forgetfulness. Have you ever felt lightheaded or off, even though your blood pressure looked good? Type yes if so, or not sure if you haven't noticed. The key is not to stop medication suddenly, but to track patterns and share them with your doctor. Bring a blood pressure journal to your visits. Write down your numbers, but also how you feel energy level, clarity, balance, because a good number on paper means nothing if it comes with poor quality of life. At Dr. Brain, we believe blood pressure control should protect the brain, not silence it. Let's move forward to step 5. Step 5, avoid certain medications that may hurt the brain. Not all blood pressure medications are created equal. Some are safer for the aging brain than others. And some carry a hidden cost. They may lower your numbers, but quietly dull your thinking, slow your reactions, or cloud your memory. As a brain doctor, hey, I've seen this more times than I can count. Certain medications, especially in older adults, can cross the blood-brain barrier and interfere with how neurons communicate. This can lead to brain fog, confusion, slower mental processing, increased fall risk, worsening of pre-existing memory loss, or early dementia. So, which medications should we be cautious with? According to the American Geriatric Society's Beers criteria and guidance from Harvard Health, older adults should be especially careful with clonidine, an older central acting agent, methyl-dopa, rarely used today, but still found in some prescriptions, reserpine, an older drug linked to depression and cognitive slowing. High doses of beta blockers, atenolol, propranolol in frail or cognitively impaired adults. These medications can affect the brain's alertness and balance, particularly when combined with other sedating drugs. Have you or a loved one ever been prescribed any of these medications? Type yes if so, or not sure if you'll check your labels later. What should you do? First, do not stop any medication without guidance. Instead, speak with your doctor and ask, is this medication considered risky for someone my age? Could it affect my memory or alertness? Is there a safer alternative in many cases? Newer blood pressure medications like ACE inhibitors, ARBs, or low-dose diuretics can control blood pressure without crossing into the brain, because you deserve a treatment plan that protects both your heart and your mind. At Dr. Brain, we always say, what clears your arteries should never cloud your brain. Let's move on to our final step. Step 6, stay consistent and informed. When it comes to managing blood pressure after age 60, consistency is everything, not perfection, not chasing the lowest number, but staying steady every day. The aging brain thrives on rhythm and predictability. And when medications are taken irregularly or lifestyle habits shift too quickly, blood pressure can swing, and that can confuse the brain, disrupt balance, or even increase fall risk. According to Mayo Clinic and Better Health While Aging, one of the most important success factors in treating high blood pressure in older adults is building simple, repeatable habits that fit your life. That includes taking medications at the same time each day, using pill boxes or reminders to avoid missed doses, keeping a small journal of your readings and symptoms, bringing that journal to your doctor appointments, asking questions until you truly understand your plan. But beyond consistency, there's another key ingredient: staying informed. The field of geriatrics and blood pressure is always evolving. What was considered ideal 10 years ago may no longer be the best for someone who's 75 or 85 today. That's why you deserve more than just a prescription. You deserve a conversation. Have you ever felt like you didn't fully understand your blood pressure plan or felt too rushed to ask? If so, type yes in the comments. If not, type I ask everything and thank you for leading by example. Because your health isn't just numbers and pills. It's about how you feel, how steady you walk, how clear you think, how deeply you sleep. At Dr. Brain, we believe routine is medicine and curiosity is strength. When you stay consistent and stay informed, you're not just managing blood pressure. You're protecting your brain. Let's wrap up this journey with one final message. So here we are. You've just walked through 6 powerful steps to make blood pressure treatment safer and smarter after age 60. You've learned how to measure better, how to start low and slow, how to trust your body more than just the numbers, And most importantly, you've remembered that your brain is part of this story, too. Because what good is a strong heart if the mind becomes dull? What's the point of perfect numbers if your balance, your memory, or your spark begins to fade? If this video gave you clarity, type clarity in the comments. Let's remind each other we're not chasing numbers. We're protecting the person behind them. And speaking of deeper protection, have you ever heard of cerebral small vessel disease? It's a condition that affects the tiny blood vessels in the brain, often silently, and it's now believed to be one of the leading causes of cognitive decline in older adults. In our next video, we'll explore the link between blood pressure medication and the progression of this hidden brain disease. Is your treatment slowing it down or speeding it up? We'll walk through the science together and help you ask smarter questions at your next checkup. Because every heartbeat counts. And every vessel in your brain deserves protection. Don't forget to subscribe and click below for our next conversation about the brain, the blood, and the balance that keeps you whole.